Mr. Speaker, for more than 14 years, this NDP government has continuously stalled when it comes to putting in place and actually implementing a comprehensive plan to address the diabetes epidemic in Manitoba. The epidemic was recognized provincially in 1996, and it continues today. It is the largest, longest, and most severe epidemic in the history of our province. Recently, the Canadian Diabetes Association has brought forward a diabetes charter, which focuses on action to improve prevention and treatment of diabetes. I asked the Minister of Health, does she support the diabetes charter, and has she signed it?
Thank you, Mr. Speaker. I'd like to thank the member for the question. Yes, Mr. Speaker, I was here actually, as were many other members of the chamber, with the day that the Diabetes Association was here, and again, the partnership that we have with them in towards building healthy lifestyles and preventative measures is a comprehensive and holistic one. And I look forward to ongoing work with the association. It is something that, as we know, has a tremendous impact on the life and lifestyles of Manitobans. And I do believe that we have much more work that we can accomplish together, and I, again, look forward to the ongoing partnerships because the work and the research that they bring forward is very valuable and contributes to the health and well-being of all Manitobans, those who are directly and indirectly impacted by the effects of diabetes.
Mr. Speaker, the Diabetes Charter specifically calls on the government for a comprehensive plan to prevent diabetes. In 1998, a diabetes strategy was developed, which could have been the start of such a comprehensive plan if it had been followed.
It was a great start.
But sadly, in 14 years of NDP government, little of the strategy was followed.
Nope.
Indeed, the NDP may have rejected the strategy for partisan reasons, but the NDP failed to put in place and implement their own comprehensive plan. I asked the minister, when will a comprehensive plan be put in place to prevent diabetes, as called for in the Diabetes Charter, and more importantly, when will it be implemented?
Thank you, Mr. Speaker. Again, diabetes and its complications associated with it can often be prevented through access to healthy foods. And in asking about a strategy, I can say that one of the strategies that we support that does this kind of work is the Northern Healthy Food Initiative and the School Nutritions Program. By investing in these programs, and in fact Budget 2014 commits an additional $450,000 for child nutrition programming for students in low-income schools, and also supports a new pilot project to help make healthy foods, including milk, more accessible to Northern Manitobans. So for those living with diabetes and other chronic conditions, we know that early detection and ongoing management by a primary care team is the best way to avoid more serious complications, which is again why the commitment to the access to a family doctor and the creation of the My Health teams, again a network of primary care providers such as doctors, nurses, practitioners and dietitians, help people manage their
The Honourable Minister's time has elapsed.
Mr. Speaker, but no comprehensive plan. In 2009, Manitoba had an epidemic of H1N1 flu. $90 million was spent to implement a coordinated plan. But since 1996, Manitoba has had a provincially recognized epidemic of type 2 diabetes, the longest and most severe epidemic ever raged in the history of our province. The cumulative number of people affected since 1996 has been about 125,000, of which more than 20,000 have died. Numbers far higher than those severely affected and dying from H1N1 flu. And yet the government has never implemented a comprehensive plan to prevent diabetes. I ask the minister, when will the government move to action and implement a comprehensive plan to prevent further diabetes in our province?
Mr. Speaker, well, again, in terms of a plan, we have a number of initiatives that are underway to support diabetes screening and management, which include training healthcare providers on diabetes education and support, the expansion of dialysis units, which also offer education to people with diabetes to prevent kidney failure and the need for dialysis, the funding of pediatric insulin pumps as of 2012, retinal screening for people with diabetes in northern and remote communities at risk of vision loss, online diabetes risk assessment tools for the public, as well as using telecare. We're connecting patients by phone with registered nurses who help them manage their condition. Telecare saw an 80% increase in the number of patients getting help to manage diabetes. We also launched again the online 2-minute diabetes risk test to help Manitobans identify and reduce their risk. The regional diabetes program promotes prevention, education, care, and support services. So more than 700 healthcare
Order, please.
providers
The
have been
honourable
trained.
minister's time has elapsed.